5 Suicide Trigger Factors. 1. Gender. Gender here can be defined as sex. Women have a greater chance of attempting suicide, but men have a greater desire and decide quickly when choosing to commit suicide. Even the ratio is 4 times more men than women who die from suicide. 2. Age. In the past, suicide prevention has largely centered on parents and young people. But in recent years, the number of suicides among the middle-aged also increased sharply. Even reportedly, people between the ages of 45 to 64 years have increased the number of people committing suicide until the late year of 2011. 3. Race. Not meant to be racist, but race is a factor that can increase the risk of suicide. The suicide rate is filled with mostly by white people or Caucasian. This may be caused by lifestyle and several other factors. While the lowest suicide rates are Asians, Pacific Islanders, African Americans and Hispanics. But as the society progresses, this statistic can change and the dominance of suicide in each race can also change. 4. Sleep problems. Do not underestimate the problem of having a good night's sleep. If you lack sleep, and the brain does not get enough rest, it can trigger a sudden anger when you're feeling sleepy. This can also trigger stress that will accumulate and eventually make you feel depressed. Even research has also proved that there is a close relationship between poor sleep quality with depression that later can trigger a person to kill himself. 5. Chronic mental and physical health problems. Among the many cases of suicide, it is mostly from patients suffering a mental illness or mental disorders including depression, eating disorders, bulimia nervosa and anorexia nervosa, bipolar disorder, schizophrenia, and anxiety disorders such as post-traumatic stress disorder. As for chronic physical illness, people with rheumatoid arthritis or cancer also have an increased risk for suicide, which actually also leads to depression due to the disease. That's it. Thank you for watching and see you in our next video.